Did you know that the liver is a vital organ that performs over 500 essential functions to sustain your life and health? By recognizing early signs of liver damage, you take the first step toward a healthy lifestyle. One of the most dangerous liver diseases is cirrhosis. This involves the progressive replacement of healthy liver cells with fibrous tissue, leading to liver failure. This unwelcome guest often stays with you for a long time, and its presence can be caused by common factors such as excessive consumption of carbohydrates, alcohol, and sweets. The tricky part is that you may not even realize this culprit is causing harm. It acts stealthily. As you continue with your life, your liver is slowly being damaged from within. Surprisingly, more than 25% of people in Western countries suffer from fatty liver disease. If you want to maintain your health, it's important to pay attention to the smallest signs and symptoms. Today, I'll be your reliable guide in caring for your liver. This video will be divided into two parts. In the first part, I'll discuss 12 early signs of liver cirrhosis. In the second, I will provide dietary tips to help your liver recover if it has been damaged. Early recognition of these symptoms is crucial for maintaining good health. But before we start, don't forget to subscribe and like this video. First point, spider angiomas on the body. When liver function is impaired, spider angiomas, small red lines resembling a spider web, predominantly on the upper part of the body, can appear. This is due to the liver struggling to regulate estrogen levels, leading to the dilation of veins and their visibility on the skin. Over time, these angiomas can contribute to the development of chronic venous insufficiency, worsening circulation, and potential bleeding from affected vessels. Second point, the most noticeable yellowish tint to the skin and eyes. A yellowing of the skin and eyes is an alarming signal of liver problems, especially when the organ struggles with processing bilirubin. This symptom not only indicates possible liver function impairment, but can also lead to a distinct yellow coloration. Third point, red palms. Palmar erythema or red palms can be a sign of serious liver issues, affecting about 25% of patients. This condition is caused by inadequate processing of estrogen, leading to the dilation of capillaries in the hands. Palmar erythema appears as reddish spots on the palms and fingertips in people with liver cirrhosis and can also be observed in pregnant women, patients with rheumatoid arthritis, lung diseases, and subacute bacterial endocarditis. Fourth point, abdominal swelling. A swollen abdomen, or ascites, is often linked to excessive fluid accumulation in the abdominal cavity, which can be a result of liver malfunctions, including fat accumulation and tissue scarring. This condition can become a serious complication as the fluid between organs leads to abdominal swelling. Ascites may also arise from diseases of the hepatobiliary system, gastrointestinal tract, reproductive system, and heart. Fifth point, breast enlargement in men. Men may experience an enlargement of the breast tissue, resembling female breasts. This phenomenon, known as gynecomastia, can be caused by elevated levels of estrogens due to impaired liver function. The liver is responsible for hormone metabolism, and when it fails, it can lead to hormonal imbalances. Sixth point, changes in nails. Nails that become thin and curved may indicate liver issues. Liver function impairment affects nutrient absorption and, consequently, nail health. The liver plays a crucial role in processing vitamins and minerals that are important for maintaining nail strength and health. Seventh point, white spots on the eyelids. White spots on the eyelids, known as xanthomas, can be a sign of liver problems due to difficulties it faces in processing blood fats. The liver helps regulate fat levels in the body, and disruptions in this function can lead to visible fat deposits on the skin. Eighth point, edema. Edema, especially if localized in the right leg or foot and leaves indentations when pressed, can occur when the liver functions improperly. Particularly if pressing on the swollen area leaves indentations. This is a sign of liver dysfunction on the corresponding side of the body. The liver plays a key role in regulating blood and fluid volumes in the body. Ninth point, purple spots on the skin. Purple spots on the skin may be related to a condition caused by hepatitis C. This virus can damage the liver and lead to an increase in liver enzyme activity, manifesting as such skin changes. The liver plays a role in blood cleansing, and its damage can lead to bleeding under the skin. 10th point, dandruff. Dandruff is not just a cosmetic issue, but also a potential sign of a lack of B group vitamins. These vitamins, critical for skin health and stored in the liver, can be deficient in cases of impaired liver function. The liver helps regulate various metabolic processes, and its inefficiency can affect the condition of the scalp. 11th point, cracks in the heels. Liver issues can reduce the body's ability to absorb vitamins, especially B group vitamins. This not only affects scalp health, causing flaking and dandruff, but also leads to the development of cracks in the heels. The liver plays an important role in absorbing and storing vitamins necessary for maintaining skin health. Last 12th point, small purple or red spots on the skin. Purple or red spots, especially noticeable on the hands and shins, can be a sign of liver disorders. This is due to insufficient production of proteins necessary for blood clotting, leading to the formation of small subcutaneous hemorrhages. The appearance of such spots may signal serious diseases, so it is recommended to consult a doctor for diagnosis and treatment. Caring for your liver. Simple steps to health. If you have encountered any of the described symptoms or simply aim to support your liver health, it is necessary to consult a specialist. A doctor may recommend incorporating more green vegetables, such as cabbage, kale, broccoli, Brussels sprouts, and cauliflower into your diet. These foods are known for their ability to reduce inflammation and promote liver recovery. Furthermore, the doctor may suggest periodic fasting as a strategy for liver recovery. Fasting days, when you reduce the number of meals or limit calories, stimulate the formation of specialized cells that help regenerate liver tissue and prevent the formation of scars. An important aspect of liver care is reducing sugar and alcohol consumption, as these substances are often major risk factors for liver health. Alcohol directly affects liver cells, causing inflammation and scarring. Sugar found in sweet beverages can have a similar destructive impact. Limiting these harmful products significantly contributes to liver function recovery and more efficient operation. By taking these simple measures, you not only protect your liver from further damage, but also promote its recovery from existing issues. The liver is a vital organ performing over 500 key functions to maintain your health. Recognizing early signs of its damage is the first step towards a healthy lifestyle. Implementing these changes can reduce liver inflammation, which often leads to weight loss and a reduction in scar tissue. That's all for now, but on my channel, you can find many useful things for your body. Subscribe and like, and don't forget to share this video with friends.